Hi everybody, how is everyone doing? Thank you for coming by and visiting my channel, listening to my videos. I highly appreciate it all. Thank you so much. A new project has just been based on coronavirus, and it will be initiated by MIT, Massachusetts Institute of Technology. The MIT researchers, what they're doing is they're tracking the COVID-19 patients and their activities, such as with who they are interacting and what are their overall movements. So this project will yet be like the largest scale so far yet in the United States regarding tracing such people in such situations. The requirement of this project is that data will be collected by volunteers who have the coronavirus or even those who don't. And the researchers have said the collected data will be all scrambled so that individuals cannot be identified. This aims at easing the privacy concerns that are in the United States having surrounded the likelihood of this type of surveillance. Among this outbreak, many countries all over the world are also using location tracking, but they have fewer protections of people's privacies and rights. The researchers said that they are in discussion for backing from the World Health Organization about how the technology should be implemented. They also are working with the United States Department of Health and Human Services and have had quite a few talks with the White House. According to health officials and scientists, the key to stopping its fast-spread virus is by greatly realizing that more testing and contact and tracing of determine how to track people who have come in contact with the virus. In China and in South Korea, in order to identify and treat patients, their government used tracking devices for the surveillance of their citizens. The MIT's project's success and aim is dependent on gathering a large number of participants, and we're still not sure if it's within the United States or on a much more broader aspect. The MIT group says they will be collaborating with big tech companies and large healthcare systems such as Big Four accounting firm Ernst & Young and the Mayo Clinic, so the researchers can obtain as much data as possible. The app will also be used to collect this data, which is called Private Kit. Also, a number of Facebook engineers are contributing their time to the project, which is led by Ramesh Raskar, who is a former Facebook executive and who also worked at Alphabet's Google X unit. Dr. Ramesh says that the model shows that even at 10%, there will be gains. He also said that it is critical to develop contact tracing strategies in locations before the virus takes a hold. And in New York, it's probably way too late now. In the United States, when a person is diagnosed with COVID-19, they are usually interviewed by public health officials, and they have been asked who they could have come in contact with over the last several days. And then those people are then reached by phone. And this process can take some days for each person. Dr. Suraj Kappa, who worked on this project, who is a cardiologist at Mayo Clinic in Rochester, Minnesota, said that the fast-spreading knowledge of the virus through an app could lead to a more selective set of closings. He also said if this works, you can create a much more curated lockdown to include very specific places of businesses and very specific areas to reduce the economic impact instead of locking down everything. So, how does this app work? The privacy concern comes in play as the new technology directs those concerns by making the data anonymous of each individual who signs up for the system and asking users to self-report. And also, before the data being submitted, users have that option to edit it. Countries such as Brazil and Taiwan are doing the same implementations. Dr. Ramesh Raskar said, a user never has to share their information with the government or any other third party like a tech company. So after the data being submitted, public health officials and government agencies will download the location of the people who are diagnosed with COVID-19, but will not be able to see any identifying information. The Private Kit app has that feature to upload your recent travel from Google location services from your phone. Then the app accesses both people who have the COVID-19 and those who don't, And then once those new users join, they will be required to start logging their locations and also can view the hotspots from other aggregated data that has been uploaded to the app. And then the app will notify their users if they are near someone who has been infected. So, if you ask me, the positive aspect of all this is I think it's a very neat way to protect our people from getting infected by the virus and staying on top of updated stats and hotspots around us and near our loved ones. I feel the app will help a lot by reducing the number of cases of the coronavirus. But the downfall aspect, I think, is privacy. It's still a concern for me. Like, what if my anonymous and location data have that risk of being misused? That's always a question back on my mind. So I think it's still a little concerning. Thank you.